Bismillah ar-Rahman ar-Rahim. Hello everyone. And sorry. In this session, I will be talking about one of the most critical decisions in the glaucoma management, that is determining the right moment for the surgery. Acting too late can cost their patient vision, while acting too early can expose them to unnecessary risk. Let's go back in time. In 1982, why do some people go blind from glaucoma? This is a seminal paper, and we still learn a lot from it. They followed patients to know why go blind from glaucoma. Patient start with varying degree of visual field, none, one hemifield, both hemifield affected. They found that the higher the pressure, the initial pressure with advanced field loss, the greater the risk of the blindness over the time. Particularly the patient with normal visual field can tolerate high pressure without going blind, whereas the patient with both hemifield affected became blind at progressively lower pressure. And there is very good message. And on dealing with glaucoma, we agree with this message. Let us look at this on another way. What are the risk factors for the progression of the glaucoma? Old age, high IOP, worse field, exfoliation, both eye have the same problem. And some of those factors in the age study are similar. We add frequent disc hemorrhage and race as well. And this is a classical slide from ages study that show us if you on a good low pressure and you never get pressure over 18, which not advanced glaucoma, it's just a glaucoma, you have a good chance of not progressing. Whereas if you didn't, you did. And so why we don't perform glaucoma surgery on more patients? Well, because worry about immediate visual loss, infection, hemorrhage, and sudden vision loss, which are very rare with careful patient selection and post-operative care. And also hypotony is more problematic, but also we can minimize it by careful flap management with using laser suture, stitched or adjustable suture. There is delayed visual loss consideration, also long-term of phlebitis and endophthalmitis, and also use the modern mitomycin using within the safe surgery protocol can reduce the risk to less than 1% over 5 years. The cataract surgery after glaucoma operation is generally safe with experienced surgeons and modern tools. And the delayed hypotony is less problematic than it's often assumed. And there is a larger study, American study, about the cause of the visual loss is similar with the patient with or without hypotony. In fact, the most common cause of the vision loss without hypotony is the glaucoma progression, suggesting that the surgery performed too late. Let me use this case illustration. This lady First, I see her in 2009 with, she was 62 years old with 7 years primary open angle glaucoma and strong family history, presented with rapid field progression in the left and the right eye and IOP under 20 on 2 medications. This is the left eye and the visual field, and this is the right eye. The operation done for the left first, then for the right, and decrease the IOP to 6 to 8. And after 15 years, the vision, the field stable or slightly improved in left and in right eye. So the surgery effectively preventing the blindness. But the other side of the coin, this lady, this referred in 2011 with normal tension glaucoma, a significant field loss in right eye, but mild field loss defect in the left eye. Myopic with low cornea hysteresis, thin corneas, and after this is the visual field. Looked at the 10-2 main deviation and the surgery. Vision remain good. But however, after next 2 years, the central vision gradually deteriorate, and by 2017, she became blind despite low pressure. Why this happened? Because the only 2 slides, please. Because 24-2 it's not enough in this situation. 10-2 is essential, and in this patient, 2 central points were almost lost. If 2 central points in the same hemifield affected from the experience, it's okay. If in different hemifield, maybe you are in a slippery slope and toward blindness. So why, when I operate in open angle glaucoma in high IOP with significant field progression, one eye is blind and the other's significant field loss, unless very poor 10-2 field. Before finished, to remember, slippery slope is gradual, snuff out is sudden, both require monitoring, careful monitoring and assessing, and their time and risk are very different. Thank you.